Good morning and welcome. We are talking to Anthem today. Let's get some housekeeping done. If you guys have any questions, please type it in the question box and we will answer questions at the end of the session. I'm Beth Davison. I am the broker advisor for Dayton and Cleveland. If you have any questions, you guys can call or email me at this contact information here. Cornerstone provides an agency services program. It's designed to help you make a plan for your business, your clients, and your family, no matter the situation. If you want additional information on this, you can go to the website or contact your broker advisor. Cornerstone is excited to announce an exclusive partnership with EB3, which is a fully customizable benefit booklet builder. We are the exclusive distributor in Ohio and Kentucky, and you have priority access as a Cornerstone broker. And now the Anthem presentation.
Okay, thanks, Beth. My name is Kathy Shiplett. I am the sales rep in Southern Ohio. Today I have with me Taylor Grant, who is our sales rep for 51 to 99. Robin Kalp is our individual and small group account manager in Southern Ohio, and Chelsea Winkler, who is one of our Anthem Specialty Connect reps that works with Southern and Central Ohio. So let's get started. Just as a quick check, Beth, are you able to see my screen yet?
Yeah.
Okay, perfect. Okay, today's agenda, we're going to be going over some updates and programs that apply to 2 to 99, so both 2 to 50 and 51 to 99 segments. Then we will have some specific updates for 51 to 99 and specific updates for 2 to 50. You can count on Anthem to deliver on our promise to reimagine health because unlike any other health company, everything we do ladders up to these 3 bold building blocks that guide our vision. All of our products, services, and innovations, everything we do, it establishes the foundation for everything that is possible. Transformative impact through our investment in people, tools, and innovation, we increase and improve health outcomes. With meaningful connections, connecting individuals to care with empathy, offering simpler, more effective, and more affordable results. And collaborative expertise, together with our trusted partners, we bring innovation through the local depth and expertise of the Blues to solve the toughest challenges. So let's start by talking about our broker tools. We are always striving to improve your experience with Anthem, and our Broker Plus app has proved to be a successful addition to our available broker tools. This award-winning app gives you access to the producer toolbox on the go. It can be used to track applications, view sales, retention, commissions for individual and small group markets. Anthem News is also accessible on this app as well as on the producer toolbox. We've also added a virtual assistant using artificial intelligence to answer questions and help with common issues. The app can be downloaded in the Google Play Store, the Apple Store, or by going to anthem.com/producer. We've received a lot of feedback and suggestions from you about finding the information you need. You said that it wasn't the easiest experience, and we agree. So we're very happy to say that the Broker Hub was built just for you to help solve the problem of where to go for what. This does replace the Your Time Matters, and if you were using this previously, it will take you to the new Anthem Broker Hub site. So if you haven't seen it yet, please check it out. It's very easy to use. No training is necessary. There are filters on the left side of the screen that will help you narrow your search. So for example, if you're looking for small group ACA plans in Ohio, you can click on those filters so it will just focus in on the information that you're looking for at that time. The Anthem Broker Hub houses selling materials for all products in one place. This is for small group, individual, large group, and specialty, and this covers all 14 Anthem states. The broker news can also be found here when you can filter by keywords or business size segment or by a date range. Another feature to help make your life easier is the ability to share any materials instantly with your client or your own team member without the need to download first. So when you click on a piece of material, it gives you the option of directly emailing it to that person without having to download it first. You can also download it to your system or just view it. So you have options of how you want to view and utilize the material on the site. You get questions from everywhere, every day, all day, from group administrators, the employees, and family members. And these questions can be about anything. So we want to be sure to give you what you need in order to answer them with confidence. As a trusted partner, your moments are our moments, and we have your back and we have a solution. So today, we're not just talking about products and services, we're talking about the moments that can be transformed. We continue to make enhancements to our producer toolbox to make it a more user-friendly experience. When running a quote for an ACA group, the quoting census can be uploaded into an Excel or CSV format. And when submitting that group as a new case, the online census enrollment template can now be auto-populated with the census used to run that quote. We have enhanced the renewal process for ACA. There's an easy dashboard to access renewals. It provides alerts for specialty product opportunities, a digital review of all plan options from the renewal packet, meaning there's no more downloads. The Producer Toolbox online submissions can be done for renewal changes and specialty product additions, and you can track the status of renewals and specialty add-ons on this site as well. So let's talk about the employer tools. With the Employer Access website, employers can manage their benefits, billing, and enrollments online. This can also now be done on a phone or mobile device with the new app version of this tool. There's a new chat bot and question and answer updated for help on using the site. And as a reminder, for your MEWA groups, they are set up on EFT so that they can view their bills on the Employer Access, but they're not able to make changes to their payments as a group on ACA would be able to do. We also have a customized website for the small employer groups with either ACA or MEWA. It includes resources that follow them throughout their Anthem experience from onboarding to renewal. Employers can download flyers and videos or email them out to their employees. This link will be is a customized site, and it's sent out to the group about 4 to 5 weeks after they enroll with us or after their first renewal following June of 2021. You can review this site yourself by going to myanthamresource.com and enter the group number. This is an updated site that takes the place of yourwelcomekit.com. If you're familiar with that, that is the link we used to send to new groups, and we have updated that to this new site. With this slide, I do want to note that this is currently only available to 51 to 99 size groups, but we expect that small group will follow soon in the future. The member plan selection microsite is a personalized benefit comparison platform that helps members select a health plan that's right for them and enroll with just a few clicks. The site is fully customizable and to an employer's unique benefit mix that includes enhancements such as Spanish language capabilities and AI-driven chat functionality. This is an elegant user interface, and Currently, as I mentioned, is available 51 to 99 size groups, and we do expect it to be available to the small group folks hopefully soon. Okay, let's move on to the member experience. Our Sydney mobile health app has been winning awards. The app is easy to navigate and provides all of the tools and information needed for a member to manage their health. Click to chat, click to call, click to schedule a call back with member services, an Anthem or an Anthem health guide. There is a smart provider finder that will only show them the providers that are in their network, easy pharmacy refills and updates, including your formulary list, a cost comparison for prescriptions, and easy to find benefit details with up-to-date accumulators for deductibles and out-of-pocket. There's also robust wellness capabilities, including interest surveys, over 20 personal challenges, link trackers. You can link your tracker on this site, and there's also embedded videos. Members can pre-populate personalized care team information, so they have all of their doctors in one view. They can use digital first options, chat or video conference with a physician. It can hold their health history in the My Health records, and it can tailor the experience to the individual based upon their history, directing members to quality, cost-effective providers. There's also wellness reminders from the Sydney Health app dashboard and personalized search, a personalized match search feature. The digital and virtual care have replaced many forms of in-person care, and consumer adoption has absolutely skyrocketed from 11% of U.S. consumers using telehealth in 2019 to 46% of consumers now using telehealth. Post-pandemic, experts predict that this shift to virtual and digital care will only accelerate. And as a health leader, as a leader in healthcare innovation, we are poised to lead this rapid transformation by continuing to design the future of digital care. This includes medical text visits, and through Anthem's application of and vendor arrangements, this is available on our Sydney app. This is also available, the Anthem Health Guide is available to ACA, SOCA benefit plan members, and ERC Health. Please note that the Anthem Health Guide is not available to our members on a grandmothered small group policy or non-ERC groups in the key market of 51 to 99. So many consumers find it challenging to navigate their healthcare benefits, and several studies in the recent years have found that consumers struggle with healthcare literacy, with only 9% understanding basic health insurance terms like deductible. With the Anthem Health Guide, members have the support from a concierge team to help them navigate their healthcare. A concierge advocacy customer service model that helps members navigate the healthcare system. Our team of experts create a simpler experience, answer their questions, advocate for their health, and help them to make the most of their care and coverage. Together, we can close the gaps in care, reduce costs, and clear the way for a more effective and sustainable system. Next up, I want to introduce Taylor. He's going to take us through some additional products and information for $2 to $99.
Thanks, Kathy. Good morning, everyone. Again, my name is Taylor Grant. I am the 51 to 99 account executive in Southwest Ohio. I'm going to go ahead and begin here just by taking a look at some of the new enhancements that we've introduced here for our emotional well-being resources. So, especially today, we've really emphasized the importance of treating emotional, psychological, and social well-being with the same exact care that we would as physical health concerns. Mental health conditions can significantly impact day-to-day life, including our overall happiness and productivity at work. So to provide comprehensive whole health support, we are launching our new emotional well-being resources program, which is going to be available to all 51 plus size groups beginning 1/1, and that's called Learn to Live. So Learn to Live is going to be replacing our current My Strength program. We're very excited for the new features that are going to be available through Learn to Live. One of the most exciting being the access to English or Spanish capabilities, which ultimately is going to help us support more employees. So a little bit more about the program. As you can see on this slide here, there's a lot of new things that we've added here for 1/1. We've got a self-guided digital cognitive behavioral therapy, or CBT, which expands access to support and eliminate social stigma barriers. Comprehensive self-assessments to facilitate appropriate program recommendations for employees and their families ages 13 and up. There's personalized care modules to promote skill building, resiliency, and mindfulness. And then, each program uses these CBT techniques to provide support for things like anxiety, depression, insomnia, and even COVID-19 concerns. We're going to have opportunities for members to engage with master's level clinical coaches via text or phone call, family, friends, and peers to communicate and encourage additional social support. And then even beyond completion of the program, there's going to be post-program surveys, mindfulness moments, and webinars to support ongoing care. So we'll go ahead and switch gears then over to the pharmacy side. Just have a couple updates on pharmacy. We are very excited for the addition here of ZipDrug on Anthem's pharmacy side. So ZipDrug enhances the member experience by connecting eligible members to a high-quality local pharmacy that offers personalized pharmacy services. ZipDrug is a wholly owned subsidiary of Anthem. It was acquired in August of 2020. It actually was being utilized on our Medicare Advantage side, but with its rapid expansion after the acquisition, we've been kind of pivoting to see how it can meet the needs of our commercial market. So beginning 1/1/2022, ZipDrug will be included in all 51 to 99 Ohio small group ACA, the SOCA MIWA, but this will be excluded on the legacy plans and the grandmother groups. So they would not have access to ZipDrug. Everyone else will have the access here. So the table on the slide here actually shows the competitive advantage of ZipDrug when we compare it to Amazon Pharmacy and CVS. So as you can see, there's a lot of benefits by using this program, which again is free with the plan itself. A few of those, are local pharmacist support and local pickup options, alignment with the client formulary, digital integration with the a member's Anthem medical plan, and the ability to tailor service by client needs and disease state. So on the next slide here, I think the most important thing to mention is, like, Kathy mentioned, the Sydney app. Hopefully we've been, really ingraining that into everyone's brains right now on just how important that tool is. ZipDrug and all of our pharmacy is going to be available in our Sydney app, so members will have access to pharmacy benefits as well, through their phone. This offers enhanced capabilities like 24/7 access to pharmacy experts, enhanced digital tools, improvements that we're making around personalized care for specialty members. And then, even beyond that, we're looking further down the road. We're always going to look at things like, leveraging voice-powered technology and artificial intelligence, allowing for live pharmacist consultations with members and more. So a lot to come here, not only on our pharmacy, but also on the Sydney app as we move forward through 2022. So I'm going to switch gears over just to provide a few updates on the specialty lines. As hopefully everyone's heard, one of the major benefits of Anthem's specialty lines is that integrated capabilities in our clinical integration. So these capabilities deliver a differentiated, more simplified experience for the member. We do that through simplified administration. We've got one bill, one ID card, one website and mobile app. We've got the clinical integration with Whole Health Connection. So, not only are we focused on better health, trying to mitigate things through the eyes and the mouth, but also lower costs, not only through, the whole health savings on the medical bundling discounts, but also just lowering overall medical costs by catching things early, and then just a better, overall member experience. And then we've got the integrated digital solutions. So, employer access, Sydney Mobile Health, all of those programs that we currently offer on the medical side are open with our ancillary as well. So they're all going to be integrated together. The member's going to have access to everything at their fingertips. I know I mentioned the bundle discounts, by adding the ancillary lines with the medical. We're still going to have a 4% possible savings off of our medical on the fully insured block and up to $3 off the PEPM on the ASO groups. So still a great opportunity for savings there by adding our, dental, vision, life, or disability. I'm going to switch over to just the dental then for a couple updates here. So on the dental side, care and compassion for our members' dental and overall health are the center of everything that we do at Anthem. That's why we're dedicated to simplifying and enhancing the member experience. It offers innovative clinical care, providing member-centric products and digital solutions, and streamlining benefits administration. So Anthem, we really pride ourselves on just the sheer size of our dental network. It's one of the largest dental PPOs in the country. We've got 135,000 unique dental providers at more than 548,000 locations nationwide. We've got a 39% nationwide network discount and 73% national network utilization. So just an absolutely massive dental network. I think it's really just trying to get over the barrier of, Anthem's more than just a medical carrier. These networks on the ancillary side are absolutely massive, and shouldn't cause any abrasion for any members, who are making a switch into the dental here. So just a couple more points on the dental itself. We are leading the benefit customization and innovative solutions. We've got teledentistry, including at-home clear aligners. So just trying to make things more easier overall for the members here by utilizing the technology that we have available to us. So I'm going to go ahead and jump to the next slide on Anthem's vision here. Again, just like dental, one of the largest national networks with a mix of independent vision providers, national retail locations, and online stores for glasses and contacts. We have 39,000 doctors in network at 29,000 different locations. Just looking at the numbers of independent providers, we still have more providers than all other leading competitors. So it truly is one of the largest vision networks across the country. Not only do we have the network itself, we also lead the industry in our discounts. 40% off of unlimited additional complete pairs of glasses, plus 20% off accessories and lens upgrades, including most non-prescription glasses. And the members can take advantage of discounts, through our special offers program as well, whether that's LASIK surgery or any expensive, glasses that are, not covered or anything like that. We do also offer a program just by being an Anthem Vision member that's going to get them discounts that they wouldn't get otherwise. So just a few more information on the Vision network itself. Again, like I mentioned, members enjoy 75% average in network savings. The network has an 80%, 20% mix of independent eye care providers versus retail network stores. The Blueview Vision network has a 97% in-network utilization rate. And then we also offer extra benefits for kids and teens as well. So there's going to be a lot of benefits baked in there for anyone under the age of 19. So I will jump over to life and disability then. The life and disability provides far more than just a benefit check at Anthem. Our life plans offer members and their families financial peace of mind and valuable services that help them during a time of change. Obviously, the beneficiary is the person or people whom the employee named to receive the life insurance benefit. So our goal is to continue to support those beneficiaries with resource-linked services for counseling and financial and legal consultations, even beyond just writing that check to the beneficiary. So our goal, is to go above and beyond the typical life plan. And we're going to do that with easy claims intakes via online, email, or traditional paper and fax processes, a personalized claim service by client, designated life claim and waiver professional, 24/7 phone counseling available for up to 6 months, up to 3 counseling sessions in person or by video within 6 months. Legal consultations can assist with estate issues, they're not just limited to those issues, but we know that after a loss, that's the type of help that, that these beneficiaries need. So our service stats speak for themselves. We, in our minds here, the average life claims processing time is just 1.25 days. We provide 100% life claims accuracy, and we've been awarded an A rating according to AM Best. So, we really are seeing the success in the numbers. So I'm going to go ahead and switch gears from ancillary and then now, really jump into the medical side of the updates here for 1/1. So really to start, hopefully everyone's become familiar with our Anthem Link product, which is our Blue Connection HMO. This was actually introduced 1/1 of 2020. And it's really been something that we've put the focus on throughout the year to continue to better. I think it was very successful, and anyone who's sold one of these networks should agree. But just a few updates on that. Anthem Link is part of a new generation of healthcare products designed to meet the desire for on-demand access to lower cost and higher value of healthcare. So the idea of a value-based care model is extremely helpful because it allows us to emphasize quality of care with our participating providers. The ultimate goal of the Anthem Link HMO product is to provide a narrow network option to reduce premium costs while also allowing our members the flexibility to get care outside of their area. So the goal here is that these HMO networks or these Link networks are going to be built in major cities around the country. And once those are up and running, members are actually going to be able to tap into those other networks, whether they're traveling or if there's a population within a group it's going to be an HMO style network that still allows members to get care outside of their home state. So we're very excited to see how this progresses. On a state by state level, region by region level, we have partnered with select providers for this product. I'll start with Cincinnati here. This product is with TriHealth, Cincinnati Children's, and St. Elizabeth. It's going to be available to all ACA, SOCA, and 51 plus groups. Currently, we're seeing a savings of around 10.3% compared to a traditional PPO plan. So a really, really big savings there. And I'll jump over to Columbus. So with Columbus, we've partnered with Ohio Health and Nationwide Children's. Currently, the premium savings we're seeing is 8.5% compared to that traditional plan. And this is also going to be available to all ACA, SOCA, and 51 plus in Columbus as well. Cleveland's going to be a little bit different here. As you can see at the top, this Anthem Link HMO is only going to be available in Cleveland to groups with over 100 enrolled employees. So this is only available to 100 plus in the Cleveland area. We partnered with Cleveland Clinic to satisfy the needs there. They're seeing 8.3% savings compared to that traditional PPO right now. But again, we're hoping that this opens up at some point in the future, but only 100 plus enrolled in Cleveland for this product as of now. So here's a few enhancements or changes for the Link HMO product that we're going to be seeing for 1/1. Again, the overall vision to build the Anthem Link product suite remains. However, there is a greater demand for expanding the Link virtual care experience across our business. I think COVID proved to all of us, that this idea of the virtual visit is a very, a successful opportunity for us. We want to provide that same opportunity on these Link plans as well. So our strategy is going to be pivoting to expand the enhanced virtual care capabilities throughout our existing portfolio of products to increase our speed to the market while we continue to evolve that Link product strategy, which is focused on coupling the digital experience with benefit designs and network strategy to achieve 2% consumer price index. So the 2022 objectives are to launch the Anthem Link 2.0 product enhancements across all 14 Anthem markets, and then expand virtual care capabilities across our existing portfolio. So as you can see in the changes at the top there, we're going to be introducing a $0 deductible plan that includes a per day inpatient copays for 3 to 4 days. There's going to be new copay benefit designs that's going to affect most services covered with a copay or a deductible copay. We'll see some co-insurance on 5 benefits only on these new copay plans. It's going to be the home dialysis, home infusion, diabetic supplies, DME, and prosthetics. So again, there will be an addition of those 0 deductible plans. In 51 to 99, we're going to see 7 new plans. SOCA will see 1, and ACA will see 1. And then we're going to be introducing our new split generics pharmacy tiering. So as of right now, our tier 1 on that essential drug list is mainly going to be the generics. We're now going to be branching that out into tier 1A and tier 1B, which is just going to be, your cheaper generics are going to be $0, and the more expensive generics that fall in tier 1 are going to be a $10 copay. So I'll move into just the 51 to 99 updates across our standard portfolio here. So just a few changes that we're going to see. We are adding those 15 new Link HMO plans, like I mentioned. 6 of them are going to be closed out, and a lot of those, again, 7 we're going to see are going to be that $0 deductible option. So we had to clear some space there, obviously, to get those 15 new plans in. The 6 that we've lost were actually not being utilized at all. Again, we're going to see those 3 new digital copay plan designs. Our PPO option 26 was updated. It's now going to be a $2,000, $4,000 deductible with a $6,500, $13,000 out-of-pocket max. Live Health Online copay minimum of $5, and it will always be equal or less to than the PCP copay. So again, the PPO copay used to be $10. Now you may see a minimum of $5, but it will never exceed the copay for actually going to the PCP on the plan itself. We did see the introduction of embedded eye exams in all of our medical plans in 51 to 99. And then for the DME and supplies, they're going to actually follow the plan co-insurance. So for any of the DMEs, it used to be just a set fixed 50% co-insurance. Now that's actually going to follow the co-insurance on the medical plan itself. So on the pharmacy side, again, we had a few slides there. We're going to be adding Zip Drug, same day home delivery. Our RxT3 plan option is going to be retired. If you have any clients currently on that RxT3 right now, they'll automatically be mapped to RxT4 at renewal unless you tell your account manager otherwise. And then again, just that's the new split generics on the pharmacy tiering. We'll see that tier 1A and tier 1B on the pharmacy side. So annual benefit changes wise, we've got the 5 changes up here. So we're going to see some expansions to our preventative services. So that's going to include certain medical tests and supplies for members with chronic condition diagnoses designated by the IRS and Treasury. So they passed a new bill that came out that expanded what was deemed as preventive. We'll obviously be following, the laws that we're getting from DC there to make sure that those are covered now as preventive. The continuous glucose monitors are now covered only under pharmacy. That looks like the 2 preferred, which is Dexcom and Libre, are going to be tier 2. Live Health Online now is going to offer dermatology visits. That will just be subject to the specialist copay on the copay plans, and then subject to deductible and coinsurance on our HSAs. We will be expanding coverage for cochlear implants. The implant batteries and cords are now covered as prosthetics, and post-cochlear oral implant therapy is now covered under the plan itself. And lastly, we've got cognitive rehab therapy now covered. It's going to pay based on settings, and there are no limits to the coverage there. So I'll switch gears into the well-being solutions. So we do have a new exciting change coming on the wellness side. So our Engagement 200 package is going to be replacing the Get Strong. Hopefully this slide, makes you feel good about that, just seeing the amount of rewards that are available here. So this Engagement 200 package is going to be available to any enrolled employee and their enrolled spouse or domestic partners. The member must be enrolled in an Anthem Vision plan to get that vision exam reward. And, as you can see with all the reward amounts that we're paying out here, it'll actually be paid in an e-gift card where that currently they can redeem in 8 different stores of their choice. So a lot of options there, a lot of opportunity to get some money. So we're very excited about the change here into Engagement 200. Next, I'll talk about our Anthem Balance Funding product. And really what this is our level funded product here in the key and large group market. So ABF provides a predictable health plan arrangement that gives small business owners more control and rewards groups when members are healthier than expected. It offers stability with competitive pricing. So this product was actually reintroduced into the market for 1/1 of this year. It's coming in at 1% higher than our fully insured proposals are going to be. So not a lot of risk there. And then just a few of the benefits of ABF. There is potential to lower the client's fixed monthly costs. We've got the all-inclusive funding, monthly payments cover administrative services, stop-loss insurance, and claims liability. So all that rolls up into that one fixed premium. If the claims amount is more than what your client has paid, they do not owe any more. They can earn money back if claims are lower than expected after they pay a fixed monthly amount. And I think the most important on the top right there, any Anthem Balance Funding client is actually going to get full access to our CII reporting package. So, one of the pain points here in our key fully insured block is, I guess, the difficulty getting reporting and information. Anyone on this level funded platform will have access to full reporting, just like a 100+ group would. I think that's probably going to be the big selling point on this product for any groups that want a little more information into how things are running and want access to that reporting. So that does it for the 51 to 99 specific updates. Again, thanks everyone for your time today. I believe I'm going to be turning it over to Robin now for some 2 to 50 updates.
All right. This is Robin Kalp. I'm the account manager for the Southwest Ohio for individual and small group. And we're going to start off with the SOCA benefit plan updates with the MIWA.io broker portal. We're excited to introduce the MIWA.io broker portal effective October 11th, 2021. We've developed a tool that will allow brokers to have more access to the MIWA.io, as many brokers have requested to be more involved with the processes. The broker portal will give a better view of the group termination verifications, Medicare exemption requests, and ARC forms. This option is designed for a more engaged broker who wants to be more hands-on with their groups. Now we'll move over to the SOCA benefit plan updates with the additional administrative changes. Recent form fire enhancements will allow medical and specialty lines to come to Anthem in one electronic submission, resulting in a faster implementation turnaround. Our ARC processes, which occur once every year regardless of the renewal date of the MIWA, is scheduled to begin early February. Proof of chamber membership will continue to be included with the ARC data collection process. Changes to state continuation versus COBRA status. Groups can now request changes via MIWA.io. A walkthrough document is included in the attached handouts. And then our new specialty upsell checklist will ensure that installations and approvals are done more quickly, and that again is included in the handouts that are attached. Our renewal action items for our SOCA benefit plan. If the group wants to renew as is, you just need to inform the account manager of the decision. Changes to the current coverage need to be submitted to the MIWA member maintenance at anthem.com mailbox, and the administrative and benefit change form and the alternative rate sheet would need to be included in that submission. If you want to add specialty, again, use that MIWA member maintenance mailbox, and that needs to be, or you can actually upload it to the producer toolbox, whichever one's easier for you, but that would include the signed proposal, benefit modification form, admin and benefit change form, and a census if it's going to be different than the current member or medical enrollment. And just remember that if the member is not currently on medical, we would need a completed application to have them added to specialty. Any terminations and enrollments need to be done on employer access, and that is for medical and or specialty. And now I'm going to turn that over to Kathy.
Hey, thanks, Robin. So I'm going to start by talking about our annual benefit changes for the SOCA BP. This year, we are going to be adding 6 new plans to the portfolio and closing 3, which will give us a total of 12 traditional PPO plans, 11 HSA compatible plans. We still have our three-tiered PPO plans, and then our 5 link HMO plans. The big news here is that we are adding the Engagement 200 package to all of our SOCA benefit plans. And this will give members a chance to earn gift cards. So like Taylor talked about this program a little bit earlier, And additional details will also be included in the materials that are attached to this presentation that you're receiving. Our preventive services are expanding. Again, this is something that Taylor talked about in 51 to 99. So it follows suit across SOCA benefit plan and ACA plans, the expanded preventive services. Continuous glucose monitors that are now covered under pharmacy, same thing. We have Dexcom and Libre that are the preferred monitors that are available as Tier 2. Live Health Online now offers dermatology visits, expanded coverage for cochlear implants. This means that the batteries and cords are now going to be covered as prosthetics. And the post-cochlear oral implant therapy is now covered under speech therapy. And cognitive rehab therapy also covered. The pay is based upon the setting, and there are no visit limits applied to the cognitive rehab therapy. The PPO and HSA plans will still use the RX Choice tiered network. That is not a change. We continue to use the essential formulary for our SOCA benefit plans, and we are adding zip drug to all of our plans. With the RX tiered network, this is where our network is tiered. So level 1, there are about 25,000 pharmacies, and with them we have the lower contracted rates, which we pass on to the members. This could be CVS, Target, Walmart, Sam's Club, Kroger, Costco, Giant Eagle. The most obvious networks that are in level 2, the non-preferred pharmacies would be Walgreens and Rite Aid. And members do have the choice of utilizing these pharmacies if they would like, but they will have an additional charge. So they will be paying more out of pocket if they are using a pharmacy that is in level 2. For our ACA plans, we are adding 13 new plans this year. 5 of these plans are called Wellbeing Perks, and this is a new plan design that we are offering for 2022. And these are PPO plans with member health incentives and employer premium credits. Very new to Anthem. We're very excited to be able to offer this year. This plan includes embedded whole health, adult and pediatric dental and vision benefits. And we'll talk a little bit more about the Wellbeing Perks in a moment. We've also added 4 Blue Access PPO plans, 2 Pathway Group HMO plans, 2 Anthem Link Blue Connection HMO plans. We are also closing 8 plans that had lower to no enrollment in them. As I'd mentioned before, the preventive services are expanded. This covers ACA. So the expanded preventive services, the expanded coverage on cochlear implants, cognitive rehab therapy, and of course, adding dermatology to Live Health Online. All of those updates apply to ACA as well as the SOCA benefit plans. With the pharmacy, with ACA, the Tier 4 cost shares are changing from a coinsurance model to a flat copay. We continue to use the Select formulary for ACA, and we are still using the RX Choice network for our ACA plans as well. With the Link plans, the Link HMO, the pharmacy network on the Link plans only is called Advantage. So let's talk about our new plans on ACA Wellbeing Perks. These are new plans that provide the members health incentives and employer premium credits based upon the members' participation. The plans also include embedded dental and vision benefits for adults and children. The employees spouses or domestic partners are all eligible for the rewards, and they can get these rewards by completing either a health assessment incentive and a tobacco-free certification. They would get a total of $100 towards a gift card. They can do an annual adult wellness exam and their annual flu shot and get $200 in rewards towards a gift card. And if they complete their dental exam, they can get $50 towards a gift card. So the employer incentives are based upon the participation levels of the members. So if the group sees a 25% member participation, they would receive 2.5% off in an employer premium credit. If they have 50% member participation, they would get 5% off in a premium credit. And 75% member participation, the employer would receive a 10% premium credit. This is based upon their total premium paid during the plan year, and that credit would be received on a bill several months after the renewal. So the group does have to renew in order to receive this credit, but a great incentive not only for the members, but it also flows through to the employers on the Wellbeing Perks plans. This is an outline of the dental and vision benefits that are included in the Wellbeing Perks plans. It is a very common outline of benefits for the adults with dental. It's a 180/50 plan with a $1,000 annual maximum. But of course, the pediatric benefits are going to be different because these are part of ACA. So their benefits are a little bit richer. They do not have an annual benefit maximum on the pediatric dental. With the vision, there are copays for adults for eye exam, lenses, frames, and so forth. There is not a copay for non-elective contacts. So that is a great benefit for adults wearing contacts. There's no copay for them on this vision plan. Pediatrics, everything is covered with a 0% copay, and eye exams, lenses, frames, everything is covered once per calendar year. And again, these are embedded into the Wellbeing Perks plan, so it is not a separate benefit plan that they have to elect. The Advantage network is the pharmacy network that is used only for the HMO link plans. This is a change. Previously, they used the RX Choice, as we do with our ACA and SOCA benefit plans, and this is only for the linked HMO. The pharmacy network is called Advantage. Robin, you can take us through some of the grandmothered changes.
All right, for the grandmothered annual benefit changes, there were no portfolio changes. The pharmacy network is now going to be called BASE, formerly known as National, name change only, so no worries there. Wellbeing package for the HSA plans is now going to be called the Legacy Incentive Package, and there were a slight change to incentives in a positive way, and that's going to be covered on a future slide. The product snapshot for the grandmothered, Kathy and Taylor have gone over these benefits, so we do have the expanded prevention services, expanded coverage for the cochlear implants, as well as the cognitive therapy. So I'm not going to beat that as like a dead horse, so we'll move on. The pharmacy network for grandmothered, again, is going to be called the BASE network. Over 70,000 pharmacies nationwide. Again, it's just a name change only. And then our grandmothered plan renewal reminders. January renewals are available in the producer toolbox. The average increase was 6.9%, with 70% of our renewals being under 10%. So we hope that is helpful in closing those quickly. The brokers' grandmothered renewals are in the legacy portal side of the producer toolbox, and the alternative ACA renewals are on the ACA side of that. So both of those should be available in the producer toolbox. The renewals go to the groups. Those should be released around October the 25th. The groups will only receive the grandmothered renewal, so the alternative ACA renewals that you receive as a broker, you need to share those with your groups because they only get the grandmothered renewal. Options at renewal. Of course, they can keep their current plan. Please tell your account managers in any renewal decision what the group is doing. If they want to move to another grandmothered plan, that option is available. The signed benefits and rate just need to be submitted to the Ohio Small Group Reclass mailbox at anthem.com. If they want to move to the ACA platform, we ask for the ACA form to be submitted by 12/5. So that basically gives us 25 days to get them implemented for a smooth transition onto the new platform. And then, of course, if they are interested in moving to SOCA, need to have a conversation with your account manager to make sure that they're a good fit so you don't waste their time in completing Form Fire if they would happen to not be a good fit for the MEWA.
Okay, let's give an overview of the well-being solutions that we have for our 2 to 50 products. This is an outline of all of the different products that we offer through ACA, SOCA, and the Legacy, and what well-being package is attached to that. So let's look a little bit deeper into what each of these mean. The foundational package is included. This is a base package that is included on all of our platforms. Many of the programs work behind the scenes to help our members with their care, such as cancer care quality program, transplants, case management. But there's also other pieces on here that you may be more familiar with. Anthem Health Guide, as we discussed. We still offer our 24/7 nurse line, Future Moms programs. Those are all included in our foundational package. The Engagement 200 is now included in all of our SOCA benefit plans, as well as on the ACA Link HMO plan. So Engagement 200 on all of our SOCA benefit plans starting 1/1/2022 with new business and at renewal as groups renew in 2022. This allows for the employer and spouse or domestic partner to earn rewards up to a maximum of $200 each year. There are 17 different activities that they can choose from in order to go up to that max. So there's a lot of different programs that they can engage in, and some of them are so simple as logging in to the website or their mobile app. So a lot of different variety there for everyone. They can redeem these for an electronic gift card. There are 8 different stores that are available, one of them being just a straight Visa or MasterCard, so that could apply anywhere. They can select Amazon, Target, Bed Bath & Beyond, TJ Maxx, Home Depot, Best Buy, or the Apple Store to have their gift card for. This is a program that they can manage and view where they are and what their options are. This is all done through the Sydney mobile app. So very easy to use, very customer friendly. The Engagement 200 Plus Fitness Plan is only on ACA plans that have plus in the name. And again, all the foundational programs are included. The Engagement 200, as we just discussed, allows a maximum of $200 per year in e-gift cards with the same ways to earn that money. the plus fitness means that they can be reimbursed up to $400 a year for their gym membership. And this is available to the employees, their spouses or domestic partners, and any dependents that are over the age of 18. They can get a reimbursement of the gym membership. There are some qualifying details that we can share with you if you have members that are interested in the plus plans on the ACA. Let us know. We can get that additional information to you on how they would qualify for that reimbursement. The Wellbeing Perks are the new plans for 2022 on the ACA platform only. This is the plan that offers incentives to members and premium credits to the employers. We have gone over different ways for members to earn the incentives, as well as the premium credits that are available to the groups based upon the participation. Reporting on participation levels is going to be available to the groups in Employer Access, so they will be able to see and follow the participation within their group throughout the year. The credit is based on the total premium paid during the planned year and will be credited months after the renewal effective date. So again, it does require the group to renew in order to receive their premium credit. Robin, back to you for Legacy.
All right. So the changes are actually highlighted in bold. The medical case management, it now includes ESRD, NICU, and transplant. The behavioral health, the emotional well-being resources replace My Strength. The care optimization program, IngenioRx, is the new naming convention for the care optimization IngenioRx Basic. And then under the clinical review AIM programs, we've removed the procedure shopper and added the rehabilitative services site of care. Now on the legacy plan incentives, which is the new grandmothered CDH plan wellbeing solutions, we've added 2 incentives. They're bolded at the bottom. So if you update your contact information, you'll receive an additional $25 incentive. If you log into the web or Sydney app, $25 incentive there. So again, a total of up to $200 worth of incentives available to the legacy incentive package. Now I'm going to kick it to Chelsea Winkler. She is our Connect specialist.
Morning, everyone. Yes, my name is Chelsea Winkler. I'm going to be your small group Connect Specialty rep for the southern part of the state. I know I've met or emailed a few of you back and forth since I started as well. We really do appreciate you guys taking the time to be with us. In this slide here, you'll see a picture of myself and Jeff Reed, who I'm sure a lot of you are familiar with and have worked with in the past, as he was the only Ohio ancillary rep until I started in January with Anthem. We work closely with your sales team. So he's who I partner with. He's my counterpart. He works in the northern part of the state with Caitlin, Nancy, and Jackie. And then I work with Vince and Kelsey in the southern central part of the state, then Kathy and Robin in the south. What we do is we are your experts for specialty products. We can help with pre-sale questions, quoting, all the way through submission, and with renewals as well. We're here to help you through fourth quarter, which I am learning very quickly is a very busy time for anyone in this industry, but I'm excited to be a part of it with you. On this next slide, I just kind of want to briefly go over our new and upcoming changes to some of our dental plans. You know, no one really buys insurance because they need it. It's in case they do need it. And on our dental, we do have our new unlimited annual max, which is really, really a great feature because an unexpected root canal or crown can really drain that $1,000 to $1,500 max that you might have pretty quick. And it really just takes the worry out of running out of coverage and, you know, paying more out of pocket than you want to. Our 2022 price points are just as great this year. We also, again, do have the whole health credit this year for SOCA MEWA benefit plans. It's our one-time credit that's applied to the medical bill within 90 days and is based on medical enrollment when adding non-voluntary dental vision or $25K of life coverage. The best way to kind of see how the whole health credit works, if you're not familiar, is if a group takes, sorry, car alarm going off in the back. If a group of 2 takes out 25K life policy, our current life rate is 25 cents per thousand, which includes AD&D. So it'd be about $12.50 a month for that 2 life group for that coverage, giving the group the one-time credit of $100. So if you kind of do the math, it would offset it and be about 8 months technically of that life insurance covered. We do also offer standalone on all of our dental, vision, life on all of our platforms. We've also added adult orthodontia coverage to our dental plans, and we've added 1 gap plan with the $1,000 annual max with the 100-160 plan as well. And again, offer standalone on all of our platforms. And I also want to make a point to make sure, just kind of say this again for everyone, is that Anthem does not require a minimum employer contribution on all of our dental and vision plans. As long as they meet that minimum participation, the employer can decide how little or much they would like to contribute. The participation guidelines on dental is 100% for groups 2 to 4 and 60% for 5+. Vision, we require 50% of eligible employees, and these these percentages are calculated after removing qualified waivers with an absolute minimum of 2 enrolling. I just always like to point that out because it really does set us apart. On this slide here, you'll see I want to go a little bit more about what sets Anthem apart from other carriers, and that's going to be our specialty products as well. This is our resource advisor. It's a member assistance program that's included with your life and disability benefits. It provides resources and services to support members and their household family members when they need it most. This includes counseling services by phone, face-to-face, or video chat. Some more resources that you can count on from the EAP is financial planning, legal services, identity theft, recovering and monitoring, and online tools. Another great feature that we have is our travel assistance program. Through the travel assistance services, the employees and families will have peace of mind knowing that they'll be able to get help if they need it while they're traveling more than 100 miles from home. We've teamed up with Generally Global Assistance Incorporated to help provide a safety net if they do have an emergency away from home. And since it's already part of your term life or the disability insurance, it's just 1 phone call away to help with any travel needs. And we also have our Perks at Work, which is a special site where members can save on electronics, restaurant certificates, gym membership, weight loss programs, glasses, contacts, nutritional supplements, travel, sporting event tickets, and even buying a next vehicle. It's also part of the Resource Advisor, a member assistance program that's included. And again, it's completely free in case I did not mention it. So all of these are amazing benefits that come with it at no extra cost. Thank you guys very much for listening to us today, and that's all I had.
Thanks, Chelsea. Well, that concludes our presentation today. I just want to let everybody know that on October 13th, we do have a legislative update that you are welcome to join. If you need an invitation for this invite, you can reach out to your Cornerstone rep and we can be sure to get that out to you. A lot going on legislatively right now, and we hope to have some information on how all of that trickles down and what it actually means, if there's what the changes will look like, how and when. So that is the end of our presentation. Beth, do we have any questions that we need to cover?
I don't see any questions on here, no.
Okay.
Yeah, we do have a couple actually. You might not be able to see it, Beth, but there's like a question section. But
yeah,
I can
on that.
That's okay. I can go ahead and ask these for you. So the first question is, so is the balanced funding only available to 50 plus groups?
That is correct. We do not have Anthem balance funding in small group 2 to 50.
Okay, and then the other question was, where are the attachments? I think that there was a reference to attachments and handouts some months back.
Okay, yeah, so we will be sending, and this can be distributed by your Cornerstone reps, a copy of the presentation. We will have links to the updated 2022 products. And when you receive the presentation, there is a section at the end, which we call the appendix. And you'll see from this slide, there's a lot of information that will be included in that. So it's going to have, information on how to track and redeem incentives, all the regulatory guidance changes, things like that. So additional information you can look for at the end of the presentation when you do receive that.
All right, that's all the questions you had.
Wonderful. Well, thank you everybody for joining us this morning. We appreciate that and hope everybody has a wonderful day.
Thanks, Kathy. Thanks, you guys. Everybody have a great day.
Thanks, you too.
Thanks, everyone. Have a good day.